previous minute meeting, which were included in the emails. Potential of 2 people to make the motion. Oh, we don't have to approve. I suppose.
Make a motion to.
Mary's trying to get on.
Here,
She said,
tell her to try now, because I didn't have it on till just. I don't see anybody to add into the room.
So I was wondering if the camera was actually working, because usually the camera moves with this, with the sound.
It's not moving.
It didn't move the last time we did this either. Only option I have to turn it back off.
Mic is on too, so it seems like it would be on.
See any people waiting to get into the room, so.
One more closer.
She's not a committee member.
Hmm?
She's not a committee member yet. She's public.
I'm shy.
I'm just a person.
Yeah, you're a person.
Rest up today.
So Mary was trying to get on, since she's not.
Person.
she texted me, they need to open up the Teams, and I said it's open.
It wouldn't have been didn't open it till this said.
I have never known a transition to go as smoothly as Stanford one has.
Yes.
Every
Tell her to try again.
empty, everything's going well.
Yeah, you're doing good. You're well.
We don't have a quorum.
Oh, well,
That's why you were just a person.
I'm just a person. We didn't have one for a med exec meeting either. I think it's the weather.
Yeah, well, this
Nice
morning,
out.
who knew it was going to blow up that little storm?
But it's okay because I didn't get down here.
Well, right.
It's all got watered.
Was the link that is sent out on the agenda like a copy of the link versus the actual active link? It's PDF versus a Word. I think it makes a difference on if it's clickable.
Different.
I think when I saw it on before I printed it, it was like in red. It looked like it was active. When I
Did I try to go somewhere and copy it from somewhere and send it to her?
She says, I'm clicking on the site on the agenda.
My computer, I can't do it with her. I'm on theirs. I'm not logged in. I don't have her.
Her personal.
Any luck?
If
Happy
we
with
give
a-
her the phone number, like we could have her call that number and move it closer. or something.
Optometrist or
I mean, I don't
ophthalmologist?
Nope.
I called.
Ophthalmologist, they're gonna have one in Eau Claire again, but
Okay.
they haven't gotten one. They actually took that one from Marshfield, so
Okay.
yes, there's no.
I called Chippewa Valley, I've been waiting for, and, that doesn't October's first.
I know.
You ready to that too, maybe?
Oh my
I'm gonna
goodness.
send
Yeah.
that to her.
Okay.
Maybe if she goes to Teams and
I
then puts
think it was
that
in
voted.
October.
Thank you.
Cataract done. I mean, it was quick after that.
Yeah.
Cataract done, but it was just waiting for the point.
Oh, I think the new patient one, because a lot of us come with records
Mhm.
of years.
Mhm.
And so, I guess understandably.
Send it around, doesn't it?
Time.
Yeah, well, I think he was a good patient, but he didn't have that.
Yeah.
I don't know.
People have to give him a
Very.
This would take.
Well, I know they said that they
Right,
only
they have
have,
like
but if we had to change anything for any reason,
Yeah. Right, I'm sorry,
we
two
did
of
have one that changed, but was that the last one?
Take
or
that much time if people show up.
Oh,
maybe I
yeah,
should
right.
Put something different. I don't know.
I think in the Houston area,
It'd be
with
my
those
error.
appointments,
But
or once, you were charged.
If you did show up, yeah,
Mhm.
I don't think they do that here.
No, but the threat of might give the incentive
They
of
might.
that's got.
call.
Yes,
You know,
true.
because usually you could fill those up,
Yeah, if they call her.
Then make this bigger.
Yeah.
or even, the day before.
Oh, the day before, definitely.
Oh, yeah, you can, right?
I'd be happy with the same day call.
Right, I
Instead
know,
of just
I know.
sitting there going, oh, it's been 15 minutes.
But you know, it's just,
I think we can go ahead and get started, just wait for me.
Okay. Sue made a motion to approve the minutes and
I'll second it.
second. Any further discussion? All in favor, say aye.
Aye.
Opposed? Motion carried. I don't see any public here unless you want to hail.
Yeah, I do. I have something for everybody too. This is the publication that was put out by Sanford Health that includes Marshfield Clinic. And it shows all the different things that Sanford offers that we will be offering proxy through them, and then also what we have. So I wanted to make sure that everybody got one of these because it's hard for people to understand like what the relationship's going to be or is currently. And other than that, we are going through the integration and it's going smoothly. Right now, we're integrating the service lines, but not. Okay, here, I'll run the same department. No.
this one doesn't have time right now, so.
Yeah.
She's
Okay.
busy.
My wife's family's from North Dakota and they've had Sanford Health for years. So
They're excellent. They have a very good reputation. They're very innovative. They're very, we found them to be very accommodating and we're learning from each other. Like if we have practices here that, Marshfield has practices that they haven't encountered or used, they're looking into them to see if they're worth having and finding that they are. And then of course, we're just soaking everything we can. So you find them to be very good.
Michelle and I had the privilege of trying to work with some of your staff with a difficult case, and then turned out it wasn't even your client. But because the client was having some memory issues,
Oh,
and they must have been Marshfield at one point, and they couldn't find the release that we sent because it was still in process. And anyway, they were very good about getting us to the right person to
There she
help us,
is.
being willing to make an appointment
there's
with
Mary.
the person. Hi, Mary.
Can you hear us?
So,
No.
and then we had to turn around and say, oh, we need a different facility altogether, but we got to go through the process.
Oh, that's good. It's good.
And they were gonna get them in right away.
Yeah, it's good.
You said they would.
Can Mary hear us?
Can you hear us?
Doesn't sound.
Well, the microphone's on. I think she can. Can you shake your head? Can you hear us? Yes.
Okay.
She's not being able to talk. She'd have to unmute. It would be on the top. There's a microphone.
Okay. Health and Human Services, an update.
Hold on, I'm writing Mary down on her attendance virtual.
Thank you.
So from Health and Human Services, I'll just go over staffing update. We will be recruiting for a DBS worker. If the request to fill form is approved by HHS committee and personnel on July 10th, that will be something that Kathy and I will be working on. Children's long-term support, we had been working or waiting for an individual to start, and she chose to take different employment, so that was re-advertised, and interviews for that position are going to be next week. In Children and Family Services, we will be fully staffed starting on Monday. Somebody was offered the last social worker position, and so that unit will be staffed. Mental health calls in adult services and in children and family services are up. Chapters are on the rise. I think already this year we have had a total amount of chapters that tied last year's total already. So I don't really know what the cause is, but there's just a lot of high needs individuals out in our community right now. We had a meeting this morning with the Lady Smith School District, Chris Soltis, Adult Service Supervisor, and Rich Green, Children and Families supervisor and myself with, I don't know, 5 members of the Ladysmith School Administration. We were talking about county services that are available to the students. We're going to set up a future meeting where our staff can learn about the IEP process, more in depth, just like an educational meeting for everyone. And then we're talking about getting into the schools at the beginning of the year or prior to the start for their in-services to talk about mandatory reporting and available county services that are available, that staff can make referrals for. And then just like something positive that I think has been going well is I started a staff spotlight. Every Monday I send out like a highlight of a DHHS employee talking about what they do for the agency and if they want to share information about their personal life, their hobbies and their interests and their family, we send that out to everybody just because I kind of feel like we're siloed with 7 departments and not everybody gets out and about to see everybody. So I just thought that was a good way to showcase, individual staff members to each other. So I think that has been going well. The responses that I've been getting back are positive. So that's it. That's what I have.
When you guys do that with, where you learn about IEPs, can I have my, INA joined?
Mm-hmm.
Cause they have to go through that with some of the stuff with screens and it would be nice to see what, I mean, not everybody has a school background.
Absolutely.
Any questions for Ashley? Okay, so, with the ADRC, Advocacy Day, I just wanted to say, it was a follow-up when we had gone. It went really good. We went down, no tornadoes. We came back. We had, I think, good talks with our representatives and just wanted to let you know it went well. We even have the bus paid, I think. Now we got the bill, so looking forward to next year and of course, keeping our, since then also with advocacy, we had reach out from Tammy Baldwin's office and we were trying to figure out a date that worked for them to meet with me here. And then they'd already set one up in Barron and it happened to be on the same day we had management meeting. So I just went over earlier and we met all together, which was great because we got to do both county at the same time and we're getting kind of getting emails around the topics that we said were issues for people with some of the stuff with Medicaid, the worries that people have, some of the things we're having trouble with Social Security office, with having to have not being able to contact them other than through email versus calling them and things like that. And the representatives were being told that we could, and then we were able to like send them the screenshots of our notices or saying where we can't from the state and from Social Security office. And they're like, well, we're getting different answers. So they're helping us weed through that to help our customers get the service they used to get, hopefully again. So it's been positive doing that. So, and then, so that's all I had on advocacy. Anybody else have anything they want to talk about with advocacy or about that day or anything else? Okay. And then,
I think it went well, and I was surprised, and Brad Summerfield actually left a meeting to come and meet with us and then went back to the meeting. So
he's really good about that. I've had the privilege of meeting with him several times because he was Chippewa County, and that's, I live in Chippewa County. That's who I always had to see. So he hasn't done that all but one time I was there. He would come out even for a few minutes. When he didn't, he sent me an apology. It's really nice. So with ADRC position status, I wanted to give you an update. And at the time I put this together, it changed yesterday. So we still had a EBS position. We had been waiting for the waiver to come back. It came back. Lisa, our disability benefit specialist, is now starting July 1st will be our new elder benefit specialist. We're not going to let well, obviously public will know if they listen to this, but we're going to put it in the source in August to give her a chance because she'll have to do all the EBS trainings. she's still gonna be doing some of the DBS stuff, and the two of us will be covering for different things while we try to have other position reapproved for hiring and get someone hopefully going there. So she's been covering and helping out really.
I got a
lot.
new job
Yeah.
already.
Yes, but Bonnie's, I told her this morning, I said, Bonnie would do this. Are you up for it? I said, I wouldn't have normally put it on her first because Angie's the backup, but she had a different meeting that she had to be in today. So anyway, she's like, yes, I can do it. So that is where we're at on that. So congratulations to Lisa. We're excited for her. She's excited to work with that population. I don't know if there's anything you wanted to say.
No, not really. Just a different group of people that I like to work with, 60 on up.
I have a question, and I don't know if it would go under Health and Human Services or advocacy.
Mhm.
I think the issue of scamming in the elderly is really hot right now. Is there anybody that would I be better off going here or to, like the police, to have somebody come and talk to the people at Flambeau Village?
We have that Independence Your Way event, which I didn't put on here, which I should have. We have the Independence Your Way event. It's on Monday. And we don't, and that has information about scams sometimes. It's all that group, there's that group that puts that together is the I-team. But there was a guy that would do that at the state, but it got caught with the Medicaid stuff and we're advocating to get him back. So the police would be the option right now because there isn't a state person anymore. Yes.
Mary sent me a text that she would like an update on the Greenwood Manor people.
Do you want to do that?
Sure.
Okay.
So I would say that that's still a work in progress. We're working on getting some assistance for some of those families that have been affected. They obviously still can't go back into their home, the apartments yet. And then with the lighthouse in crisis, I think that's kind of up in the air as to where those individuals are going to land with their budget crisis. But right now, I think that there's still 5 or 6 over there, but everybody is still working, doing follow-ups with them, economic support, ADRC, adult services. We're still kind of keeping tabs on them and assisting them as they call. I know that there was a couple incidents where they needed some help with laundry. So we were able to get some laundry cards so they can use the local laundromat to go take care of some of those needs.
And on the ADRC side, we've been doing a lot of housing applications and Lisa's in 7 at a time, sometimes applications for people. And we've also been evaluating some people that are on that border that could maybe go into a long-term care program and getting some of the people that are in that situation hopefully out of a nursing home into maybe to assisted living, since they don't have a handicap apartment that they can go to. So we have a few of them that we're helping that way as well.
When you say the lighthouse crisis, is there a crisis, another crisis other than being too full?
The crisis is we don't
Financial.
have enough money.
Okay, funding.
And that's not probably gonna get any better. And just an aside, I think the county, ADRC, the staff and the health department did an excellent job with the Greenwood apartment fire. I just was down in Milwaukee. They had a apartment fire of 85 units on Mother's Day, and they still had the shelter open. And one of the nights that I was working, there was a guy that passed out. I think he might have had a seizure or something. But when you call 911 in Milwaukee, you get transferred 2 or 3 times to get to the right ambulance service. The high sign is they got there very quickly because they transferred you to the right station, and the guy's blood sugar was like 500, so he needed to be, taken care of. But this was going on for 5 weeks, and people were really, the Red Cross was struggling to get volunteers, and when they're willing to have me come down for 5 days, but I'm not used to working 12-hour shifts. And it was- they needed somebody on night shift more than any place else, so I learned how to sleep during the day. But it was interesting. It was, I mean, it's because it's so much bigger population, and this was an older low-income housing unit, and these were pretty needy people, and they liked living in the neighborhood that they were in, which became obvious that wasn't going to happen very quickly, because they'll go through the same process as our apartment is, that the new regulations and stuff is going to make it pretty expensive to fix. And it was 85 units.
It's good to see that they've been emptying out the stuff out of Greenwood when they, they got that fencing up. Have the dumpsters and stuff out there, so it's good to see that they're doing that. Some progress. Do we have any, are they still at a year out? Do we know?
I haven't heard an update as to when people will be able to move back in.
Hoping that at some point they'll give public, not just the people, some kind of a update too.
I haven't heard
Who
anything.
knows, maybe it's way too early for them yet either.
And I think, when you start just taking things apart, you can see what's happening, but now, the supply chain is going to affect everybody that's doing any construction.
Right.
So. Hard to know.
Did we answer your question, Mary? Yes. Okay, so health promotions update right now, the one thing we have going on starting in July, on the 7th of July, it'll be, I think it's an 8-week one. They'll have stepping on going on. There's still openings for that. It's on the front page of the source this month in June, and it will be again in July because they want to fill that. We have Kathy Helber and Kay Serfoss, so it's both volunteers this time that are doing it, where before we had Alyssa who we had to pay. So it's nice that we have both volunteers, and the only thing we have to pay for was Kay's training. And Kathy's been trained for a couple of years now. And then the hope is that when this one's done, maybe we can do another one in the fall here as well. So I just wanted to let you know that one's coming up, and if you know of anybody, it helps with balance. And I know you guys at the clinic, you guys have a lot of I drop off a bunch of the sources and stuff. If anybody knows anybody who's been having falls, please send them Melissa's way. She would, even if they don't get into this group, we can put them on the wait list for the next time too.
Make sure that the ED has some too, because they get patients in the fall and, they might be able to give them information. I help them, I should say.
Thank you. And then anything else, any other questions for stepping on, or health promotions? That's pretty much just the only thing that we have extra going on right now with that. I think we got some extra funding there, but I still have Laura checking on it, make sure that if it was kind of some of that COVID funding that I thought we couldn't get anymore, I just don't want to say we have it for sure until she says yes, we do. But and then with the peer place and data entry, I'm probably just going to leave this on here and just give you guys generics about it each time. It seems like every month they add another piece that we have to do. I know I've said this to you before, but I'm going to keep saying, I feel like here, some of us have really got they can do it and it's boom done. Like Kay for aging side, she says she's got it down and it's easy to do. But I don't know. I'll speak from what I know from the INA side. I don't think it's the same there. They keep adding another step. Like, I'll give you an example. Like before, if we had a customer we met with, would go in, we'd put in their general data information, and then you would put in, click the tabs that said if what you did for them, and then you had your little write-up, and you had your initials and click and done. And we thought that took forever. Okay, that's nothing compared to what we're doing now. It's if you have an INA one. So now instead of being able to click the tab and it does, you have to, if it's an INA, you follow these steps. If it's an intake, which is more than an INA, which they didn't have available at first, but now they do. Now you have to do a whole different setup, which has probably 10 more steps. And then anything after that, and then don't close it until a certain point, and then wait, don't close any of them. Oh, now we're saying you can, but only these ones. And it changes so often that I can't say for every county, but I can say for in this office, we're confused. And we're trying our best. And the state is reviewing it every month and saying, oh, we see you haven't done this yet, and telling us something else that we have to do. And it's like, which is in a way good, right? Because then you know you're not doing something that you should be doing. But you have all these people you're trying to see, and now instead of it being, like I said, I thought 5 minutes on one doing an entry was a long time, and now you're taking a half an hour on one, and you have all the people. It's just, we're behind, to be honest. We're doing the best we can, or just keep trying to keep caught up. And I've told you this before, when they first called us champions, they lied. I am not a champion in it, and now they've changed the wording because they know that's not really what this is. We're a liaison to help when they have a mistake to be able to delete it, but only under certain circumstances, because they don't want you deleting this one because it goes into it doesn't go away. Just deletes the person's name, and then it's still out there in the system. So we have all these different things we have to follow that way as we're learning it. I'm not saying it's a bad program, I'm saying it's a lot to learn, and they keep changing it. And eventually we'll get it down, but right now we're not there. So if you go to a meeting in our board meeting in in the ADRC there, and our numbers look like crud, that's why. It's not that we're not seeing people, it's just we're trying to get it entered and have all the right drop downs. And still see all of our customers. So I just wanted you to be aware. I think Lisa with the DBS side, hers a bit, you've been able to keep up with yours and everything's going well there. Hers is a little bit more similar to what we had before. Same was the EBS, a little bit more work, but similar to what they had before. But the INA is like a whole new world. So anyway, just letting you know that, hopefully one time I'll be sitting here saying, this is so great, but I'm not there yet. But
Can I add something to the scamming thing?
sure.
Isn't Alicia kinda her position where there's scamming going on? She's someone that they could contact?
Yeah, for APS, Adult Protective Services, you can.
Yeah.
She doesn't do speeches at this point yet though for it.
No, not quite there yet, but if there's a specific person, like that there might be some fraud happening, then that could get reported to her. But maybe not like an educational piece. Or she's gonna present anything, I don't think.
I just added it because at one point years ago, my mom was scammed.
Mhm.
Either Brenda or the bank called me. My mom was getting in her car to go to the bank and get 15 grand out. And so it was a very,
Yeah, situations like that, yeah, APS report, absolutely.
very
Yeah.
saved.
And I think, like the banks are so limited in what they can say. I mean, unless they've been adjudicated incompetent and they are demanding their money, they can kind of tap dance and delay it as long as they can, but their hands are tied. At the apartment, we're kind of limited because, we're not intended to be surveilling everybody, but, when something's going on, it makes everybody nervous.
Right, but I know they saved us in that APS and the bank. So.
Were you guys involved in the news that was on the radio today? That there was a guy that was just prosecuted for fraud for senior citizen on
The one that
Russ County.
sheriff posted.
Yeah.
All that.
It was on the radio when I was coming up.
There's
It was on the news.
two separate incidents with an elderly lady. And
I'm not sure if
the one that was arrested and ICE was involved is not the one that
Okay.
is involved in Plainville Village. Yeah, it is. And now they do know the person that is, they've identified the person, but they can't detain him. So we're supposed to watch for people.
What's his name?
Of the individual.
Yeah. I mean, if it's out there, you might as well put it out there.
I care. Kerr. I don't know if the name is out there, but I guess it is now.
But law enforcement is aware that this is happening.
Oh, yeah. Excuse me, sorry.
Thank you. Okay, I'm gonna go on to aging. Aging, for staff updates, we have, I had told you, that we had done interviews, for the Hawkins mill site or maybe we hadn't had them yet, but anyway, she has started now. I think she had already, we had interviewed, but, Tanya, started and, RYSA, I think. She's right, in Hawkins. She already works, with, EMS and, EMTs, over there. And, so she's a county employee before this. So, she's happy, a new mom. She's happy to be, able to work close to home, and, the part-time is good. It allows her to keep doing the other work that she enjoys. And, I think she's on week 3. She's on week 3 now. So, she's doing good so far. We've been communicating and, to visit Hawkins a little bit more to help her with some things. It's good. I hadn't been over there in a while, because our site manager had been there a long time, so they knew her stuff, so. And not saying that she doesn't, she's just learning. She's doing great though, so. Otherwise, on the aging side, we haven't had any new changes for staff. Then, any questions on that? And then for commodities, we have, with the Greenwood, we had the 6 people that were on, and, all but 2 of them have gone off. One is saying that they want their box, but they haven't, been able to. I don't know if they're out of minutes, but sometimes I get a random text, don't get rid of my box. So I'm keeping it, but I'm not really getting a phone call back. And if I can leave a message, if it's not too full. Anyway, I don't know how long that's gonna go on, but the other ones are out of the area or going into assisted living, so they have all come off, which made a big changeover of how many different people. So if you'd been in my office in the last month, I've had a lot of boxes in there because of keeping theirs, because not wanting to keep wanting to make sure that they get them because of their situation, if possible. And then getting the new people onboarded with that, and had today my first transfer. So like if you're in the program in a different county that's with the same overseer, like we have West Camp as the overseer, we have the same one. I learned that I knew that they could transfer. I never knew what a transfer looked like. Even my question is, we're already at capacity. Like we have a waiting list. So do we then get to go up one? Do they have to go to the top of the list and they don't get a box yet? How does that work? And at least for this one, they told me that we get to add him. So now we have 96. So, and he came and got his box today, was pretty grateful for that. Transferred from Barron. So, and anyway, so it's, I think it's a moment in time because they can only have so many boxes total in their region. So I think that's why they said I have to check myself. So,
Your boxes that are accumulating in your office, is that for lack of them picking it up?
no, it's because I saved them for Greenwood,
Right.
and then I had to get new people and get them and get a hold
So-
of them. Yeah. And
Having somebody help delivery would not solve that.
I don't think so, but thank you for thinking of that. Yeah, no, I don't think so. I think I would have had volunteers that would have helped do that too if I needed, if that was the issue. But, it's more the ones from Greenwood. And then there seems to always be like a potpourri, like a potpourri of people that when you have 90 some people on a program, not everybody has somebody else. And if they let me know ahead of time and I know they don't have anybody else, I bring the box up so they can still get their food for the month, because we're talking 34 people,
Yeah,
right?
right.
And so it is like not this month, but last month, I think I had 4 car issues. And everything they told me, I know they weren't lying, like, but like 4 car issues where they couldn't get here. And then like this month, it was a lot of people, like I have one in the hospital, with surgery, one with, who had surgery, but could come, but not for 2 days later, and can you carry my stuff down because I can't carry because of the surgery. And, so this month, the thing was surgeries. Last month, it was car issues. Who knows what next month will bring? And I know that some people would love to see it be where it could be like, if you don't show up, they just don't get, but I just can't seem to pull that trigger because I feel like then.
They are the neediest of the needy.
Right.
Yeah.
And if my office is a little crowded, I can handle it. And since the front desk is willing to help distribute, it works. If they were to quit doing that, then that would be an issue. Or if they try to give me more frozen meat, that would be an issue because I just don't have freezer space. Luckily, WIC is letting me use their part of their freezer space, but it's always a crapshoot. If they have breast milk, then I can't have my food in there.
Right.
So then Michelle lets me use her freezer space sometimes, and Angie. But theirs is not very big either. So we do our best. But that's only till October, and then they might not have that, and that might not be an issue anymore. But I just think with these numbers, I'm just gonna be still bringing some back, but that extra 5 or 6 it just makes it seem like so much more than that,
Yeah.
than like having 5 or 6, So I'm happy to say I'm down to 5 today. Yeah, so just wanted to give you enough update on that. I think it's a really great program. Had a really, we use volunteers mostly outside of myself to do that. And even then, sometimes I'm not having to go. Did have a little setback. We had a volunteer for us being paid through that Share SER program for seniors. And that person had to resign. It was physically, the different things she was doing was too much. And so that'll be a loss because she was taking on a lot more of that for me. So that'll come back my way, and hopefully we can get someone else or some other volunteer that would be willing to do more of that. And then, so that's everything with that. And then the next thing I had was this, if you notice, it has different initials. So it was always SFMVN or VP, not NP. And so if I ever pronounce it wrong, it's been over a decade of me saying senior farmer voucher program. Now it's nutrition program. Vouchers. So that's why the wording changed, because they changed their wording. And so I'm trying to educate you on that, but also get it locked into my own brain. So we had that start, they gave us probably, I don't have the exact number memorized, but we used to get only 112, and now I think it's like 168 or something they gave us for vouchers. So it's nice, we've got more. However, the value is less, like with their COVID money, they were able to give us $45 the last couple of years, and now it's at 25. The great thing is if people get the vouchers in Ross County, so in order to qualify, you have to be over 60, be in the income guidelines that are again on the front page of the source, just like our that we're stepping on the other side of that. And then they have so over 60 Ross County resident and be in the income guidelines. So we had our outreach sites where I went to the different sites. Kathy Halverson, she's in charge of both of the farmers markets for the the county, she came along too to share about their information, and then I shared ours, and we were able to get, that first, in one day, we gave out over 80 vouchers in one day by going around the county. And then, I am down now to 19 left of the 168. So they're going really fast. Because of that, I'm not gonna put it in the source of, for July, because, she'll also help us if we have any left with people. But like today, I think I had 7 go out the door. So people are calling, and then I don't know when's a good time to come grab them. And so I think they'll go fairly quickly. We can do a waiting list for that. The great thing with the market, what they've done for years is they've tried to do the double coupon, and Kathy and the group of people, Martha and all those different ones who, I don't think Martha's this year involved as much. And still is, but they, starting that double coupon, now they have it really solid, and it's like pretty much, instead of saying while supplies last, they're saying we have the money for this. So that's really great for people. And the thing was, like, our stuff is only good for fruits and vegetables, the stuff that we get from the state. But, and Kathy corrects me, says it's good for produce because it's also good for herbs. But, and hers though, and only at the approved vendors for ours, and for theirs, any vendor in those 2 markets you can go to, and it can be meat, cheese, it still has to be food. It's not just vegetables and herbs and fruit. So it opens up that option a little bit more, so people can get like a full balanced, fresh.
That's true of like the breads and all of it. Okay.
And Kathy says, if you have any questions, and I know, like, I think it was last year they implemented, or maybe it was even the year before, they've been having the carts for people down there. And so they could do that with Kathy and the other person who's in charge on Wednesday, because she does Saturdays, and other one, I'm not sure which one does Wednesdays. I think it's Martha and her husband, but I'm not positive. And anyway, they'll show people around and show them how to use the coupons, and how to get the most value out of them.
Good.
So it's I think really growing. And when their vouchers for ours are good across the state at any approved vendor. And so whenever I'm talking about it, I ask them, do you ever go to a market in a different county? Because you can, and here's how you would find them. And the more this has grown, I've been, like I said, doing this for over a decade, right? I would be giving out lots of stuff on the other counties, and now that our market's good, I think I only had 2 that wanted outside of that. In addition to that, if you're in Ladysmith, Kathy got some approval, for some free bus passes to help people get to the market and back. I'm able to give those out if people are only doing the bus as well. So, and then if they need more, they can get them from the market. But they've come. She gives out a maximum of 2 to begin with. They say right on it, only good to go to the market, so you can't use it for something else. So I think that's a great thing that they've all worked on getting going and building to make that inclusive for people to be able to come.
The voucher amount is for the season, not just for the month, right?
Correct. It goes until October 31st. Thank you. You're right. Yep. So I just wanted to share that program with you, because I think it's really good, and it's something I'm super busy with right now. So, but it's going well. I love it when they go right away, because then they have more choice throughout the year. And the reason we keep getting higher in numbers on that is because we, in our county, they encourage us to keep a wait list. So if you show that you have a huge need, they'll give you more. So we show them, and every time we keep growing a little bit. I don't know if we'll continue to grow, but hey, other people are getting cut and we've grown, so I think we're doing it right. Plus, they also look at usage, and if people are actually using the vouchers that they received, and that's a weighting factor. So the fact that they're actually getting out there and using them not only just picking them up, but using them is making our numbers as well. And I think that partnership with the farmer's market helps because
Yeah.
they feel comfortable using it. And I think even having the carts made a big difference because people that use walkers now can walk like everybody else through there because they got the cart, pull them up like a walker, and they don't have to look any different. So that's really nice. So, I just left that reminder, all meetings will be at 1 because I'm probably leave that for a little while too, just because we used to flip back and forth and didn't want anybody to forget. But then with other updates I'll start with what I had there, and then I'll let you guys go. We have on Monday, we have the 11th, I think it is, annual, and I had it on my desk and I left it there, flyers for you guys. So if you want some, I can run them down quick. For the Independence Your Way event. So, with the Independence Your Way, we normally have 2 different speaker groups. One's, and they have different topics that they're talking about. This year, both of them are panels. So the first one is like some panel about some different things we've been doing for health and keeping for, normally we had to have one that's around scams and one that isn't. We have a little bit with that, but not as much this year. And then the one in the afternoon is more about like resources. And then we also have like vendors. I had to top it out at like 13 vendors this year because they only allow 60 people at a time to Jump River, but it's such a beautiful facility. I don't know why it's got such a low number that it can have because if you go to the library, the space is smaller and they can have 120. But it is what it is, right? So, and it's just a beautiful facility and we, I think it will be a really good event. We're partnering with, Kathy Helber is in charge of a group of, that she does, what does she call it? Remember what she calls the, well, anyway, she does the buses over from Hawkins and they come over and she lunch and learn, maybe is what she calls it. Do you know, Mary Sue? Does Kathy call those lunch and learns? Is that what she calls them when they come over?
Lunch and learn, yeah.
Yeah, so the lunch and learn group is gonna be part of that
Okay.
day, and we're using their same person that cooks the meals for that, and she's only charging us for half the raw food cost. The rest is all donated by her time, everything else. So, she's a chef, so it should be good. It's not fancy because we didn't have much of a budget, but it will be good. And we got some of our partners in that group because it's a bunch of different organizations, right? Written for different grants. So like we're getting some breakfast items, light breakfast stuff like donuts and bananas from Quick Trip that were donated by them. And then Walmart is providing the dishes. This is gonna go.
What time is that?
Starts at 9 on Monday until noon, eating at 11. Dexter.
That's why I say, and are you texting her?
Fell asleep
It goes until when?
till noon. Eating is at 11:30, so you could be
Okay.
out of there sooner if you wanted.
And the sessions are both in the morning.
Everything's in the morning, right?
Yeah, but I mean,
There's
at the
one
same time.
at 9, it's vendors till 9:30, then we have the first panel.
Okay.
And then you have vendors again, so we can regroup
Okay.
and then the next panel.
I think that's a great program.
Yeah. Yeah, Erica started it, I think the year before I started working here, and then we've just been going forward with that since then. Anybody else have any other updates or questions about that? That's my list.
Say the next meeting is June 19th. It's August 21st.
No, it should be August 21st.
I think this June 29th.
Sent you. Look I printed it, it says, I must not have pushed save. Well, that means it's posted wrong.
Depends on which page you're on.
Yeah.
Well, if you're on the minutes from last time, it would say, because that's,
19th.
yeah. the
This
minutes
one says.
On the agenda,
First.
on the agenda, it says August 21st, right?
Well,
No.
On the agenda,
Meeting
it's the June 19th.
you do have the date on here, but it makes it look like the next meeting is today.
Oh,
It says
no.
21st right there.
Mine just. Okay, so that means I didn't push save, and then when I send it to you, I'll have to fix that. I'm sorry.
It's below, but.
Yeah,
I mean,
well,
which, everything.
obviously, when I printed it for the ones to bring down here, I had it with the right stuff. And it's not saved. What I do is I bring up the old one and I change the dates
Yeah.
and make the changes in it, and I must not have saved the changes and sent it off to you, not with the old. I'm sorry about that. But I thought I had it that way.
August 21st.
And the one you have, because you got whatever I printed, right?
I don't know what you guys are looking at, but mine says August.
Right,
For the ones on the table, they have the right dates, and the one that I posted, but the one I probably sent to them, it would be the same that I sent to you, so I'll have to see if it's wrong there.
Okay, we've completed the agenda, so we adjourned.
Thank you.
You can do that.
Leave that.
Yeah.